many women have lost their lives as a result of them not being informed or not being aware of the danger signs of pregnancy. Dictating early these danger signs and then seeking for help immediately can go a long way to save the life of the mother and that of the baby. That is why on this video, I'm going to be sharing with us those danger signs of pregnancy that when you notice, you rush to the hospital so that your life and the life of your baby can be saved. Welcome to Antenatal Faith Clinic. I am Nozi, if you are seeing me for the first time. Bring you interesting teachings related to pregnancy, labor, care of the newborn, reproductive health care teachings for all ages, as well as healthy tips for those who are trying to conceive. If this sounds like what you love to hear, please click the subscribe button, hit the notification bell so you get notified anytime I post any videos. First danger sign of pregnancy I'll be sharing with us is bleeding. Whenever you bleed at any stage of the pregnancy, whether at first trimester, second trimester, third trimester, it is a danger sign. The bleeding could be an indication of a premature separation of the placenta. It could be placenta previa or abruptio placenta. Or the bleeding could be as a result of trauma, maybe from a fall, and then later on you discover you are having a kind of bleeding from your vagina. It is a danger sign. The bleeding could also be an indication of an ectopic pregnancy, meaning that the baby is not growing in the uterus. It is growing somewhere else. If you notice any form of bleeding at any stage of your pregnancy, please rush to the hospital so that your life and the life of your baby can be spared, can be saved. Another danger sign is the premature rupturing of the membrane. A sudden gush of amniotic fluid, or it could be that the fluid protecting your baby in the uterus is just dripping or leaking. If you notice a sudden gush or dripping of the fluid, it is a danger sign you don't remain at home, because at this point your baby is open to infection. It is also a danger sign because a cord prolapse can happen, and when a cord prolapse happens, there's a shortage of blood supply to the baby, and you can imagine when there's a shortage of blood supply to your baby, what will happen? You can lose that child. So it is a danger sign when you notice a sudden gush or dripping of amniotic fluid, of water that is not urine from your vagina. It's an obstetric emergency. You rush to the hospital so your life and the life of your baby can be saved. Another danger sign is reduced fetal movement. At this point, you must have established the normal way your baby moves. If you notice a decline in the way your baby moves, or at all, within 24 hours, you've not noticed the movement of your baby, it is a danger sign. Please rush to the hospital so that the fetal heart and other assessments can be made. Another danger sign is swelling. Your legs are swollen, your face are puffy, your hands are swollen, and when you apply pressure, especially on the ankle of your feet, you discover that it is pitting on pressure. It is a danger sign of pregnancy. You don't remain at home, you go to the hospital so that they can rule out preeclampsia, and then you can be treated appropriately. Another danger sign you should take note of is severe headache. Severe headache in the absence of fever. The headache is so severe to the point that you begin to see double. Your vision is blurred. It is an obstetric emergency. It could mean that your blood pressure is elevated or an eclampsia is imminent. Another danger sign is convulsion. Pregnant woman is not supposed to convulse in pregnancy. This point is for whoever is around a pregnant woman. Please, if you notice any pregnant woman around you convulsing, save her life. Rush her to the nearest hospital so that her life and the life of her baby can be saved. Another danger sign is severe abdominal pain. Severe abdominal pain could be an indication of a preterm labor. Severe abdominal pain in early pregnancy could be an indication that an abortion is imminent or a miscarriage is occurring. Severe abdominal pain could mean that you are having a urinary tract infection. It is a danger sign in pregnancy. It is not normal with pregnancy as some people claim. Please, if you notice any of these danger signs, don't remain at home. Rush to the hospital and save your life. Another danger sign in pregnancy is difficulty in breathing. Shortage of breath. You struggle with respiration. Little thing you do, you are exhausted, excessively tired. You struggle with breathing. You struggle with everything. You walk a little distance, you are tired. You are losing breath. It is a danger sign with pregnancy. Don't allow anybody deceive you that it is common with pregnancy. My dear, it is not common. It is a danger sign. Run to the hospital and seek for help. Save your life. Save the life of your baby. Another danger sign in pregnancy is fever. When you discover you are having fever, serious fever, it could mean that you have a malaria. Malaria in pregnancy can lead to a lot of complications, both to you as the mother and to your baby. When you give birth to a child, that child may come down with jaundice. Don't do self-medication. Don't do self-medication. If you notice any of these danger signs, rush to the hospital so that you can be properly cared for. Danger signs are signs that when you notice, you don't remain at home. You run to the hospital so your life and that of your baby can be saved. Save the mother, save the baby, save the father. If you enjoyed this video, click the subscribe button, hit our notification bell so you get notified each time I bring in new interesting videos. Thank you.